Hi, everyone. Welcome to our RightsCon panel entitled Frontiers in Health Data Privacy, Navigating Blurred Expectations Across the Patient-Consumer Spectrum. My name is Dr. Rachel Hendricks Stirrup, and I am the Health Policy Counsel and Lead at the Future of Privacy Forum based in the United States. The Future of Privacy Forum, which I'll call FPF for short, is a think tank based in Washington, D.C., and is a catalyst for privacy leadership and scholarship, advancing responsible data practices in support of emerging technologies. And my work there specifically focuses on issues at the intersection of privacy and ethics along the patient-consumer spectrum. So now, many of us know that healthcare is rapidly transitioning from a periodic activity in fixed settings to an increasingly complex and complete integration with all aspects of our lives, be it through sleep quality sensors, smart toothbrushes, smart watches, direct-to-consumer genetic testing, you name it. But perhaps unsurprisingly, though, individual experiences with and expectations of health data privacy may vary along the patient consumer spectrum or really become blurred across these rapidly expanding contexts. So this risk is actually more acute when health data is collected using the same kinds of modern technologies that I just mentioned in both traditional health and recreational contexts. These phenomena really, along with a growing dependence on big data, a term that many of you have likely heard, which would involve the combination of health data from traditional and non-traditional health information platforms, suggests again, that there is a growing blurred line existing between the expectations of health data privacy and really as we navigate our lives from being patients and then consumers, or consumers and then patients. So today we're going to talk more about that. And I am joined with my esteemed colleagues, Carolina Rossini, co-founder and CEO of the Portulans Institute based in the USA, Megan Doerr, principal scientist of governance at Sage Bionetworks, also based in the United States, and Teresa Conceição, international privacy team head at Novartis, based in Brazil and Portugal. So again, it is my pleasure to welcome you three. And before we get started, I'd like to perhaps share some poll results that may or may not have come in at this point. I did present a poll question for the audience that asks, should the privacy of consumer-generated health data be treated the same as traditional healthcare data? Yes or no? So I'm curious to see what our poll results look like as they come in. Until I see those results, we can probably get started with a few questions for our panelists. So that being said, I will start with Meg Doerr at Sage Bionetworks. Meg, so my first question for you on this topic really has to do with arguments out there that there's an unequal or unbalanced distribution of risks and benefits to data sharing across healthcare and health consumer contexts. So what are your experiences and perspectives around this argument based on current events, past events, things that you've encountered, in your practice and what you do? Tell us more about that.
So I think we're in a really challenging time when it comes to health data because we're starting to recognize the power of myriad data to inform our health. And so we're drawing data from any number of different contexts. With the launch of Apple's Research Kit in 2015, and then the subsequent development of Research Stack, which is the Android platform equivalent, researchers have been able to create research studies that use apps to gather data about people's health. And these data wouldn't necessarily traditionally be considered health data, but have been really, really interesting when we start to think about their power in addressing different health conditions. So, for example, at Sage Bionetworks, we helped develop some of the original Research Kit apps, and then have used these data for Parkinson's research, for research in breast cancer, any number of different conditions. So I think we're in a really interesting place where we're transitioning out of health data being just one type of information that's generated at a doctor's office or from a hospital stay, and we're starting to see health data that is much broader in context. Carolina, did you want to add something to that? I noticed that you had a thought there.
Yes, please, Carolina, share with us your perspectives as well on this.
Sure. So first, hi, everybody, whoever in the world you are. It's wonderful to join RightsCon online this year. I've been to many RightsCon and helped put RightsCon together last year. So it's a wonderful experiment. So thank you for joining us wherever you are, whenever, whichever time zone you are. So thank you, Megan, for setting that context. I think it's a very important context to understand also the risks and the perceptions of benefits, right? One of the things we see is that data, even if the scientists like it or not, end up being a political issue, right? It's not everybody, for example, that can afford a certain device to capture data. So you and at the same time with that, it's not everybody that has an iPhone or like a device that you put in your wrist. But at the same time, we have long historical examples that actually show that a lot of populations around the world, especially indigenous, right, the natives of that certain country and minorities or the Black community actually were abused over and over again. And that also happened on data collection or the lack thereof, right? The lack of data collection and how the inexistence of good data from that population can actually impact research and in the long term, the health benefits of that population. So that's very interesting to see how data governance mechanisms that Sage Bionetworks work, that you work, Megan, can actually deal with that, right? So data should be really representative, and that is also a big discussion at the consumer side, right? When you discuss AI and other issues, or privacy by design, or good AI, right? Or things like good digital ID, right? Every time we try to put the word good in front of something, that good is related to representation. So how can everybody benefit from both consumer technology, but also health technology, but also be protected, right? And then informed consent is a big piece of that. So I'm gonna stop here. Thank you, Megan and Rachel.
Yeah, I know that, Carolina, you brought up some very excellent points. And I think what really resonated for me in what you just said is that it's likely that the lack of data collection could be just as dangerous as the misuse of data that has already been collected, especially for underrepresented populations that that might receive some sort of benefit or lack thereof based on the presence of that data or absence. So that actually leads me to my next question. Meg, given your clinical expertise as a genetic counselor, you can probably shine a lot of good insight into this question. But how should data be collected and shared, and really, along the lines of being intentional about data collection and data use, and the uses in a non-biased way, and also collection in a non-biased way to solve problems like, for example, the global pandemic, COVID-19. What should that look like? Should it be similar in clinical context versus consumer context? What are your thoughts about that?
So I think that this is really the $1 million question, right? There's no doubt that sharing data accelerates biomedical research. We've seen this in any number of different contexts. We know this now with the global pandemic. We're sharing data to try to move this faster. In addition, sharing data is a parsimonious way of approaching science. Like, it reduces the cost of science, it reduces the infrastructure, the resources that are needed to conduct replicable and reliable science. So there's no doubt that there's benefit from data sharing. That said, though, privacy, once lost, can never be regained. And this is the rub, right? We know that sharing data accelerates biomedical research, and we know that privacy, once lost, can never be regained. And it's that tension between doing good as fast as we can and also protecting a resource that is not renewable, privacy, that we need to navigate carefully. Oftentimes we are lulled into thinking that it is an all or nothing. It is a black or white. Data are either open or they're closed. Things are shared or they're private. And I think for biomedical data, we really need to start thinking about all of the gray, all of the space in between totally open and totally closed, and work that space. So one of the frameworks that we use at Sage BioNetworks, the nonprofit open science organization where I work in Seattle, Washington, is we think about who are going to be accessing the data, and then what freedoms are they going to have with those data. And it's that combination of who and how free that leads us to an appropriate governance structure for the data, so an appropriate approach to controlling those data. So a few things there, so within this availability and freedom framework, the availability component is really thinking about what kinds of data users are going to use it. So are people going to be included in the data use if they meet certain employment criteria? For example, they work at a academic medical institution, or are they going to be excluded if they work for a pharmaceutical organization? What training do those researchers have? So are only formally trained and credentialed researchers going to be allowed to use the data or not? And then what kinds of attendant documentation do they need to have? For example, do they need to have in the United States an ERA Commons ID that would in some way signify that they're a scientist? Now, one of the challenges there is that you start to exclude large classes of solvers, right? So community scientists or scientists from non-traditional contexts would be excluded if you go with very traditional structuring of the availability question. On the side of freedom, so again, we're thinking about availability. If you want to think about it on an XY axis, you could have availability on one axis and freedom on the other axis. Those are the constraints under which those researchers have to work. So, for example, can the data be downloaded and redistributed? Are there fields of inquiry that are excluded from acceptable use? What kinds of ethical oversight is required of the data set? And so within that space of availability from very closed to very open, and freedoms from very restricted to more free use, then you have a whole space within which to work. So you could have pairwise sharing in there. You could have clubs or data trusts. You could have open data, which includes citizen science. You could have model to data, which is one of the novel approaches that we've been using recently with data that are highly sensitive, but still we want to be available to a large group of people. And then you can also just have closed and restricted data sets. And all of these are better than the black and the white, than just saying things can only be closed or they can only be open.
Oh, I'm sorry. Go ahead.
No, I know I've been talking a lot, but I think one of the things that's important to note is that when we think about the nature of the data, like the terms under which the data have been collected, as well as the stigma associated with those data. And I think that this is where we come back around to COVID, right? So data that have social stigma, for example, HIV status, or can be used to limit or deny rights. For example, COVID status, right, limits your entry into a host of nations and subnational regions at this point. Those data are much higher risk to share than other forms of data. And so that's the trick here, is that there's the data have different sensitivity, and then along these availability and freedom axes, then you can select where in that space you want to go. All right, I'll stop talking. Rochelle.
No, I love a lot of what you just said, because I think it really stimulated my thought around the very point of this discussion is along that patient consumer spectrum, and also with what exists within that spectrum are various perceptions or expectations of privacy. There's also a very, very much blurred aspects of even privacy protection. So for example, in the consumer space, where health data is collected, and also used for research and used to inform, clinical care in some cases, that data is not as protected as it is in traditional research settings and traditional healthcare contexts that would involve a provider, an insurer, a pharmaceutical company that also has rules to abide by, for example, here in the United States with the Food and Drug Administration. So Teresa, with all of that being said, given your role as a privacy leader at a large global pharmaceutical company, what are your thoughts on that in terms of comprehensive, or understanding what comprehensive legal protections should look like for or along this spectrum of consumer health / patient data? Tell us more about your experiences and your perspectives on that.
First of all, thank you, Rochelle, and hello, everyone, wherever you are. I hope you are enjoying the conference and having good discussions and insights. So picking from that, and there's so much to start elaborating from what Carolina and Meg have already shared. So, but it's exactly like you just mentioned, Rochelle. So the traditional health data environment is really regulated. And it works within a confidence and trusted space. So pretty much every country in the world has this confidentiality, doctor-patient legislation. The clinical trials environment it's actually regulated through the authorities, to the good clinical practices, and of course privacy and personal data protection of the participants. It's critical to definitely prevent harm for the individual. And as we evolved, we are seeing that data collected, which doesn't apparently seems like Meg was saying, health-related data, it's actually when linked to a certain use or to a certain purpose, it does become health-related data. And there it seems, or in fact, it is the fact that not all countries have comprehensive personal data protection legislations. So, but the first thing that I wanted to stress is that pretty much every country have this traditional health data regulated space where confidentiality and privacy and data protection is applied. And why, my personal view, why is it that some countries really do not start it by having this? First, because most of the countries, they have sectorial laws which cover privacy aspects. And we have strong examples of this in the health sector, as well as the financial, the most common sectors where the legislature is always thinking about. But then you have the culture of the country, the past and the history of the country that actually can drive you into have more stringent legislation than other countries. Also, another factor is the government's and authorities' key priorities. So if you need to prioritize education, health access in terms of treatments to your population, then you might since you have already the sectorial laws, tend to neglect a general privacy law. But again, it's also important to stress that there are a lot of countries with these legislations in force. And I wanted to share with you an example from Brazil, which actually it has a lot of privacy legislation scattered through different sectors. And now it's currently developing a general data protection law. And this, I believe it happens not only for economic driven purposes, because you then become a country that you have a general regulation on this topic, which it requires companies to consistently take the same approach and actually to be accountable when we bring in the regulator. So when we are talking about the consumer spectrum, and then we are putting or using the data more on the consumer perspective, then the same safeguards and the same accountability needs to be put in place, as it needs to be put in place for a health and traditional regulated sector, which the driver is not exclusively privacy, but it's also the safety and the efficacy of the medicine in itself, right? So this is, in my view, something that triggers the difference. And I wanted to continue, and just by adding that it is very important, or I believe at least to be very important, to support and to drive the need for this general data protections legislations, because it brings consistency and harmonization, and it definitely usually has the prevention of the harm of the individual in its core, and so it will potentially allow for a more greater use of consumer data in the health environment, giving the expectation actually giving it in terms of privacy and confidentiality to the individual, and preventing against discrimination, against loss of economic opportunities, and of course general harm, which can be physical or mentally, of course. So, but then again, I now will close with this: the political and the political context of a country, the way it is organized in itself, such as federal government and state governments, it can pose some conflicts. And then again, it's even more important to have one strong regulator aiming for consistency and help, and mostly giving the opportunity to have strong interactions with regulators, such as Sandbox, which is a great example coming from the ICO in the UK, where it was actually launched a program where companies could submit, provided their project was related with new technology and it was on the public interest. And it's with great pleasure to say that actually Novartis was one of the elected between the 63 or 64 applications, and you actually discuss and you reflect on all of these situations, balancing the benefit for the individual, the society interest, and the protection, while the regulator keeps its entire autonomy. So it helps you, but whatever it is the end and the conclusion of that process, the regulator will not be bound because of an interaction. But this strong interaction definitely is constructive to the benefit of the individual and the interest of the society. Thank you.
Awesome. That was very thought-provoking, Teresa. And you said a few things that resonated with me, and also inspired some questions I have around general data protection. Like you mentioned, a lot of us are aware of the, or at least those in the health or general data protection and privacy space, the General Data Protection Act, it being a comprehensive set of privacy protections over consumer health data in some instances. And that general data protection framework is quite different from the framework we have here in the United States and other countries like Brazil. And those differences are there probably because of, or I would argue, based on what you said, due to cultural differences around privacy and what that means, what it should look like. the culture of innovation, a country's ability to support innovation in ways that are probably of highest priority to them and also to the global economy. So Carolina, what are your thoughts on that? It's a topic that I think a lot of people think about but haven't really explored in context from a culture and innovation sort of way. So what are your thoughts on that?
Sure. Sorry, I was just unmuting myself. And for folks on the line, our poll question is back. So just to repeat what Rachel said before, should the privacy of consumer-generated health data be treated the same as traditional healthcare data? So that's the question for you guys, if you want to join us in that question. But coming back here to what my girls were talking about, there are a lot of things to unpack here, right? So one is the topic of how this can benefit all, right? And the same thing that joins to that is that we see that data sharing benefits, right? So has Megan brought, and then Teresa brought, but there are some regulatory barriers that we should take in consideration because they are important, right? So these are some of the three topics we've been discussing. And if you actually abstract them to the normative environment, you have a lot of human rights that are conflicting here, right? Access to health, privacy, and even economic development in a certain way, right? So that's one of the things I also bring to this spot. So Portuland's Institute houses a lot of the most accepted ranking indexes out there on countries. One of the indexes we host, and we host the partners, is the Global Innovation Index that we developed with WIPO. And exists for a couple of decades, right? The other one is the Network Readiness Index, and we also, and our my co-founders are also behind the Global Technology and Competitiveness Index, focus on people's talent and skills. And one of the things that we see is that actually the ability of data sharing and a regulatory environment that is transparent and set and brings trust to the market, even if there is hard regulation, is where innovation happens, right? If you think about the global South, I'm originally from Brazil, actually. If you cannot share data, your local companies are not as competitive as other companies in the world, especially in the global North. You see. Like I worked with Creative Commons through all my life, and I always bet on open as a way to go, right? So, and you see, for example, Microsoft recently bought GitHub, which is another signifier that open brings value, right? And brings competitive value, I mean. So I really like to see how can we reduce the transaction costs to share data in a way that respects. And I really wanted to record and coach you, Megan. I love that, the privacy and the sharing. I need you to repeat that for me later. But it's a perfect balance. But sometimes people want to give their privacy away. If I have a son or a daughter that's about to die and really needs to be part of a research, I don't care about my privacy or my kids' privacy. And we see that through health. So that's why sometimes other type of regulation might become more important than privacy in some cases. So, and you guys mentioned briefly, right, the discrimination, anti-discrimination regulation, and all this, some regulation around benefit sharing, depending on which population you are gathering data from, right? We do have benefit sharing schemes on access to biodiversity. Can we discuss that? And I'm not the biggest supporter on some movements that try to create ownership over personal data, like health data. I think that really brings a very unnecessary discussion, and you're trying to monetize something that individually does not worth much. What worth is the collective, right? For research and for innovation. So I think that by really having an environment we can trust, that my health insurance will not be cut out, or I will be able to circulate, right? Through, even if I'm 10 days after my COVID positive test was done, I should be able to circulate around states in the US, right? So if my basic rights are not taken away, right? What is the legislation? Brazil already has a privacy law, as you said. Now it's figuring out how to implement it. But again, Brazil needs to go further, right? And work on the non-discrimination part of that piece. So and at the end of the day, I'm not like a software developer, nothing like that. But with all the technology that's gonna come with super powerful computers that can later break anonymization and encryption and all that. What was the name of the computer? I'm privacy will be a social contract, right? It's gonna be impossible to protect privacy with technological means, right? So we really needed all this supporting regulation to ensure that we share data, because that creates innovation, that creates competitiveness, that creates better research, but people are also protected in the long run.
And Carolina, let me add that you brought up a very interesting piece, is that some people are willing to share that their own information because they do believe in the benefit that may come out of it for research, for further development. But that brings us to two topics in my mind, as coming from the legal perspective and also for the pharmaceutical perspective. It's the trust. So you need to have a safe and trusted environment for people to willingly do that. And that's why general data protection, although not all the same between the countries, set the standard for whatever operator, including coming more from the tech sector and the consumer spectrum, but on the other hand, is linking to purpose, right? So you have that trust, you have that willingness, but and in the health sector, you have the vulnerability of the individual. You said it yourself. It might be the last resource. So it is even more important to bring that trust, so that actually innovation can come forward, research can be done, but within the balancing of the benefit to the individual and the prevention of a potential harm, as well as the interest of the society. So I just wanted to spot on these two topics: the trust and then the vulnerability involved in such a sensitive context such as health.
Can I make a question for Megan on that relation? Like, what is the role of informed consent then here, right? It uses the answer for everything.
Yeah, so this is what I was going to build off of what you, Carolina and Teresa, have said, because I feel like you're right on there with these conflicting human rights, like this very complex calculus of the right to science and the right to benefit from science, and also with our innate human need to care for others, those that we are related to, those that we love. Like, if our data can help others, I always call this the grandmother clause, like, because if you told my mother that she could help her grandbabies in any way, she would give up the privacy of anything in order to help her grandchildren, right? Because this is one of our natural desires as humans. And so this is where privacy regulation becomes so important. So regulation around how can these data be used, preventing these data which have been shared for altruistic benefit from being weaponized against the people who are contributing their data is so critical, and weaponized intentionally and also weaponized through like bad AI. There are many ways that we're seeing that bad machine learning or unintentionally created algorithms can perpetuate discrimination in all sorts of different contexts, including in health. And so we need to be very, very thoughtful about the way that data are able to be used, and very intentional in the way that we use data, so that we don't take something that's been contributed for good and intentionally or unintentionally use it for discriminatory purposes. And all of this also connects into the idea that data itself, health data itself, and data generally are not individual. The data about me tells about my family members. My health data implicates many other people. And so all of the models that focus on data as an individual attribute, I think, don't take into account the data ecosystem, really all of the varied levels of the ecosystem, which are also critical when we're thinking about privacy regulation and the regulation of the use of health data. Jasmine McNeely has done some very interesting work in this field, and I would point you towards her work. But coming all the way back around to Teresa's point about trust, one of the challenges that we have with using biomedical data and biomedical data broadly constructed to accelerate discovery is credentialing of researchers. So we use proxy systems for credentialing researchers. We use proxy systems for the trust that Teresa was mentioning. So if you're working for an academic medical center that's well known within the world, if you're working for an international pharmaceutical company, you might have that trust, but you have that trust as an individual researcher only by your affiliation with this larger organization. And we know that a lot of great discovery happens in all corners of the world by all sorts of people who don't have the benefit or the opportunity necessarily of those affiliations. And so one of the challenges or the problems that I think deserves attention is, how do we create a system for credentialing researchers that could be internationally recognized, which could serve really as a strong foundation for that trust that patients and concerned caregivers give to us as researchers to help solve these health problems that they're so concerned with.
Yeah, that wonderful remarks, Megan. And I like that you brought up Jasmine McNeely's work on data trust. I actually follow her work as well. And being a data privacy person myself and a data governance person, I certainly appreciate discussions on this topic. And in fact, when thinking about this within the confines of our topic or focus here of the patient-consumer spectrum, really what that looks like, I think, is that there's big data out there coming from the patient side and then the consumer side, and all of that is blended into one perhaps centralized place, be it a repository, be it even in an electronic health record database that's interoperable with consumer generated data systems. Thinking about all of that and what trust looks like, be it trust for my immediate future generations, my grandchildren, as you mentioned, or for those in the future who have a data profile that looks like mine, or based on that data profile, evidence that would suggest that this treatment might work better than that treatment, or that this continuum of care might be better than that one. So thinking about this or that particular context and what the benefits of data sharing should look like today, and what trusted mechanisms of data sharing down the line in the future should look like. From a data governance perspective, perhaps Meg, since you are the principal scientist of governance at Sage BioNetworks, thinking about all of that and trying to figure out what we can do today to make sure that we don't have winners and losers or haves or have-nots along, the patient and consumer spectrum in the future. What are some things that we can do today? And Meg, this is a question for you, but I also, ask Teresa and Carolina, you both as well. What can we do today from the policy side, from the open data science side, the governance side? What are some things we should be asking ourselves in terms of context and other clues we might be able to find within those contexts to understand what we should do today to protect those tomorrow?
Yeah. So so from like a very pragmatic standpoint, ensuring that the informed consent for research, which Carol brought up just a few moments ago, making sure that our informed consent processes are transparent and comprehensible to the broadest group of people is really like basic practice and needs to be a part of all researchers' work. So anybody who's collecting data for use in biomedical research should be paying attention to the terms and conditions and the informed consent that they construct, and they should be constructing it in a way that all people can understand. And I think that this is really one of the most
just lawyers.
Yeah, not just lawyers. Like it's not supposed to be a legal document. It's supposed to be a document of understanding between the people who are contributing their data and the folks who are holding their data in trust and using it for the advancement of science and the advancement of our understanding of health. And so making sure that we really do our due diligence there is like essential, basic work. Also recognizing whose data we have and whose data we don't have, and recognizing individuals' expectations around data sovereignty and data justice are really, really critical. I think we're seeing, certainly within the United States, with the attention now focused on civil rights again and discrimination again, we're starting to see how data justice and data sovereignty are going to be critical issues as we move forward with solving. If our data sets don't include all people, if the class of people who are invited to solve on those data are not representative of the communities from which those data have come, then we not only do a disservice, we miss out on insights. So we may deliver solutions which are not applicable to all people. We might deliver solutions which are not solutions at all to the communities from which those data have been derived. And so I feel like we can do very simple things, informed consent, very practical, right? But then we have to take a hard look at who's included and who's not included in the data that we're using right now, and in the solving that we're doing, who's included and not included in those class of solvers.
And if I may add to that, you still have a huge problem, which amazes me, right? We are almost into 2021 because 2020 stopped in March. What day is today? March, when COVID started here in the US at least. But it's the digital divide, right? So many countries lack broadband plan nowadays. And why this is relevant? Because then people that need to be part of the data sharing and they want to be part, they can't, right? Because they don't have access to the basic ICT that would allow them to participate in a lot of things. Or they don't have access because a certain test is too expensive, or because the center for that research is too far away from their community, right? So what are all the physical barriers, right, and the digital barriers that we should also be tackling to avoid the risks Megan was pointing out?
I wanted to also I believe in the same sense as you were mentioning, it's about transparency. And when you mentioned the informed consent, it's not a legal document. It's not even a medical document. It's a document that it's actually it has one recipient, which is the patient. In this case, I believe we are really talking about the patient, or it cannot be. It can even not be a patient, because in clinical research, at a certain point, there are no patients, but healthy individuals, right? But it's very interesting. And when the GDPR came into force in 2018, there was a conversation from the European authorities, which was the interplay between the GDPR and the clinical trial regulation. So the privacy regulation and the clinical trial regulation, because at certain point in time, consent can somehow give you a false control. And this has nothing to do with the lack of transparency. So the critical point is really transparency. People should know and need to know who is collecting, who is using the data, and for what purpose. So I know we often talk about the consent, and in the clinical setup, consent is often the medical and the clinical consent is often brought. But actually, this was a discussion brought up by the General Data Protection Regulation in Europe, because the consent is really in privacy very specific. It needs to be free. And this again links with the vulnerability, I have difficulty in saying this word, of the person. So, and it was a discussion brought by the regulator in trying to evolve, in protecting the individual, right? So I thought it was, and digital divide in that case.
Yeah.
We are seeing all inequalities rising up during this time, right?
Yeah, for sure. And I think that this also points to, as we're starting to integrate more consumer generated data into biomedical research, the frame of informed consent starts to break down, because it's almost impossible to give meaningful consent in all of the different digital contexts in which a person could exist. And all of these digital contexts, we're starting to realize, maybe can tell us about health, maybe can contribute to our understanding of health. And so well, I'm a huge proponent of the importance of comprehensible informed consent. I think that the regulatory framework that we operate in as data collectors and data users is really, really essential, because that effectively sets the floor, right? It says to people, here are the ways in which your privacy will be protected, or here are the ways in which your data can be used and can't be used. And without comprehensive, to bring it full circle back to the beginning of our conversation, without comprehensive regulations within nations or across nations, the patchwork doesn't benefit people, doesn't benefit patients, doesn't benefit those who are altruistically driven to share data for biomedical research. Certainly in the United States, that's the case.
And we do have new techniques that can support this data sharing, right? So we have the possibility to apply privacy differential, so that you every time build stronger models that does not leave you back to the singling out of an individual, or that you cannot conclude exactly how this individual either responded, if we're talking about a survey, or exactly what his or her health data is. We are also seeing increasingly talks about homomorphic encryption, where so the data sits there and there are so many levels of encryption that really prevents anyone from having access to the raw data, right, without preventing the analysis to be made and for the suitable answer or advice to be given. Of course, it's still emerging. It has been there for quite a while, right? But it's still emerging, considering the costs, technology, and everything. But it's ways to move forward with.
And go ahead, Rochelle.
Oh, no, go right ahead. Actually, once you comment, Carolina, I'm going to go over our poll results with everyone. And then if anyone has any questions at this point, please feel free to pose them at this time while Carolina speaks. And afterward, we'll go over those questions and poll results.
Awesome. Thank you. No, there were a couple of comments that I saw specifically regarding one of the things I commented, and I think it's a very important thing to. So one of the participants said, I can see why one should give up privacy to be able to get medical help for our children, emergency situation. It should be possible to share data while privacy is maintained guarantee. I completely agree with that general statement. That should be the standard no matter what. But over history, and I'm happy, I don't know how we can follow up with participants after RightsCon, you see a lot of parents asking help to the world, right? If you saw campaigns in Facebook from asking money to asking blood, right? You are actually letting go the privacy of your kid when you post her name, her picture, her location, her bank account, whatever, right? So there are situations where people desperately look for collaboration. So the privacy is gone at that point. But then how you prevent that kid to be discriminated against by their health insurance later in life, right? So that's also what I think it's important. It's not just privacy, but it's a set of regulations to protect that individual. And it's hard to generalize how individuals will behave in an emergency situation, right? And I saw over and over again, there are so many documentaries, right? Even Netflix movies of around those situations where the parents just do everything they can to save the life of the children, and privacy is not a priority at all. So I just wanted to make that comment, and thank you, Rochelle.
Yeah, no, thank you for acknowledging that comment from the audience. And speaking of our audience, I'll go ahead and share our poll results with everyone. It looks like we're pretty much 50-50 split, closely 50-50 split, around just over 50% of our audience members feel that, yes, the privacy of consumer-generated health data should be treated the same as traditional healthcare data. So again, largely 50-50 split, but it looks like slightly more audience members believe that, yes, the data should be treated the same, consumer-generated versus traditional. And there's another comment from our audience member about the topic of discrimination. And Meg, this is something that you brought up early on in our discussion. One of our audience members stated that we need to acknowledge the risks are very different for different groups. For example, vulnerable groups with an HIV positive diagnosis, that particular group is often criminalized or subject to widespread discrimination based on that health status alone. And so that being said, the risks or perceptions of risks even of data gathering around that are not always the same or disproportionate. And then in addition, speaking of informed consent, Teresa, you mentioned that, that process alone can be subject to duress if it's linked to a life-saving treatment or service. So I think what our audience member there is trying to point out is that, you know, privacy is very contextual. That context can be a discrimination context, a life-saving context, whether real or perceived. So one thing that I think is important to mention there is that, you know, even if one cannot prove that discrimination is there or that imminent threat to one's life is there, if the perception is there, that can also, you know, cause harm along the patient and consumer spectrum. So thinking about context, thinking about perception, I think that's a really important part to drive home in this discussion. And in addition to that, we mentioned the digital divide. I think that's something I really want to talk about and close with for our discussion now that we have about 5 minutes left. The digital divide in and of itself, it's something that I think we all know is happening out there. It contributes to both the lack of data collection among some groups, which again can be harmful in some ways. Data gaps, it results in data gaps. And it can result in harm done or lack of services provided to those down the line in the future because data was not collected about them or people like them. So I really want to close talking about the digital divide and what that means today in our pandemic, what that means for future generations, what it means for policy moving forward. What are your concluding and closing remarks on that topic? I'll start with you, Teresa.
Okay, so I just very briefly going back to context, it's really interesting. So the Brazilian, and also coming to a point that Carolina said, the Brazilian law, which is strongly inspired in the GDPR, but it's not the same. It has a specific provision that prevents health insurance to aggravate the premiums based on information, health-related information. This is very clear in the law, and also regarding the use of personal information. So when you mention privacy is no longer there because it's on Facebook. And there's also the need to still comply with the rest of the principles and requirements of the law. So the information was publicly made available for a specific purpose. So it links with context and links with purpose and against the trust and the security. And general data protection laws really contribute to at least prevent, again, coming to discrimination and harm to the individual. Okay, so general tone on the consistency and the digital divide. From a policy perspective, I mean, I personally believe that it should at least be a government priority to try to reduce inequality from this sense, and this also applies to the education level, because then you are empowered to your self-determination on the use of information, right? And how you apply the information that you are receiving, and you have the ability to think critically about it and not just be manipulated by the information others feed you. So actually, from the policy perspective, because this will also fill in the gap that the data is being collected from all spectrums of the society, and the less favored are not left behind, because that will definitely lead to greater discrimination. So, and this is not a very objective policy, but it's, in my humble opinion, to be kept in government's mind.
Yeah, I think that's perfect, Teresa. That's completely on point. I agree 100% with you, especially in times of misinformation and like an information overload and even governments, right, that we can trust less because they are behind a lot of misinformation campaigns. Individuals need to have ICT tools on their hands to figure out what they want to do, and figure out what they want to do in terms of their health, in terms of what are their rights. Are those rights protecting them if they want to share, if they want to participate in a research? What does it happen in the long term, right? And it's amazing that even I live here in DC, right? Even in DC and Maryland, which are like, it's rich neighborhoods, like of the US, over 50% of the kids in my son's public school didn't have computers. So, and 15% of them didn't have what to eat, right? Which amazes me, right? So we have to have those basic tools so folks are empowered to be part of innovation, to be part of research, and to really benefit from technology advances.
Wonderful. Meg, feel free to close, and I'll provide a few final remarks at the end.
Yeah, well, I'm really excited about the conversation that we've had today. And I agree strongly that we need to be thinking carefully about the ways that we include people, their communities, in both the data gathering and in the data use, in the solving that happens. Thanks so much.
Wonderful. Thank you all. This has been very reinvigorating for all of us and thought-provoking. And I want to share with the audience that I believe a recording of this session will be available to all registrants of RightsCon. Thank you all for joining us. Thank you for participating in the poll and posing your comments. We really appreciate it. And we'll see you at more RightsCon to come over the next couple of days.
Bye, everybody. Thank you.